Today, we're jumping into a topic that so many women deal with, but it's often shrouded in mystery. I'm talking about Polycystic Ovary Syndrome, or PCOS. We're going to demystify it, what it is, what's happening inside the body, and most importantly, how you can manage it.
All right, let's kick things off with a quick question. Just think about it for a second. What is the most common endocrine, hormonal disorder for women of reproductive age? Any guesses?
Yep, you got it. It's Polycystic Ovary Syndrome. And that's exactly why we're dedicating this whole explainer to it today. Its impact is just huge.
And when I say huge, I mean it. We're talking up to 1 in 5 women. That's up to 20% of women in their reproductive years all over the world. So let's be clear, this is not some rare, obscure condition. It's incredibly common.
Okay, before we get any deeper, let's tackle something that trips a lot of people up. PCOS versus PCOD. They sound almost the same, right? But they're not. PCOD is generally seen as a less severe condition, something that can often be handled with lifestyle tweaks. But PCOS, that's a full-blown endocrine disorder. It's more complex and it has these really deep metabolic roots. All right, so to really get PCOS, we have to look under the hood, See what's actually going on with the body's hormones. Because really, this hormonal imbalance, it's the engine driving everything.
And a big piece of that puzzle is androgens. Now, you might hear them called male hormones, but that's a bit of a misnomer. Women's bodies make them too, just usually not as much. The key with PCOS is that the ovaries start producing too much of these androgens, and that one thing kicks off a ton of the symptoms.
And that androgen issue is tied directly to another major player, insulin. Get this, a massive number of people with PCOS, we're talking anywhere from 50 to 75%, also have something called insulin resistance. It's a huge part of the story, and it can happen no matter what your weight is.
So what is insulin resistance? Well, here's an easy way to think about it. Imagine insulin is a key. Its job is to unlock your body's cells to let sugar in for energy. But with insulin resistance, that key is, it's kind of faulty. It doesn't fit the lock properly. So sugar can't get into the cells easily, and it ends up just hanging around in your blood. And this is where it all spirals. Your body senses all that extra sugar in the blood, so your pancreas goes into overdrive, pumping out even more insulin to try and fix the problem. But all that extra insulin floating around, it sends a signal to the ovaries to make, you guessed it, more androgens. And that just makes everything worse. It's a perfect and perfectly frustrating vicious cycle.
Okay, so that's the sciencey stuff happening on the inside. But what does that actually look like on the outside? How does this hormonal chaos show up in real life?
Well, the thing about PCOS is that it looks different for everyone. There's no single checklist, but some of the most common signs are things like irregular periods, or maybe no periods at all. Then there's excess body hair, that's got a clinical name, hirsutism. You might also see stubborn acne, weight gain, especially around the middle, thinning hair on your head, skin tags, or even dark patches of skin. The key thing to remember is that everybody's experience is unique.
Right, so with all these different possible symptoms, you're probably thinking, how on earth does a doctor actually diagnose this thing? Well, there's a very specific method they use.
It's all based on something called the Rotterdam criteria. Think of it as the international rule book for diagnosing PCOS. And here's the most important part. You only need to check off 2 out of 3 main boxes. And of course, this is only after they've ruled out anything else that could be causing your symptoms.
So what are the 3 boxes? Number 1, high androgens. That's either something your doctor can see or something that shows up in your blood work. Number 2, messed up ovulation. Basically those irregular or missing periods we talked about. And number 3, polycystic ovaries that they can actually see on an ultrasound. And I'll say it again because it's so important, you only need 2 of the 3 for a diagnosis.
Now, it's not just a checklist. A good diagnosis is like detective work. It'll involve blood tests to see exactly what your hormone levels are doing, and usually an ultrasound. This helps to confirm PCOS, but just as important, it helps rule out other things that can look a lot like it.
Okay, getting a diagnosis like this can feel overwhelming. I get it, but this is where the story shifts from what's wrong to what can we do. It's time to talk about the PCOS management toolkit.
And here's the thing. Pretty much every major medical body in the world agrees on the starting point. It's not medication. It's not some complicated procedure. The absolute first-line foundational treatment for PCOS is lifestyle.
So what does lifestyle even mean here? It really boils down to 4 key areas. Eating a balanced, nutritious diet, getting regular movement in, aiming for at least 120 minutes a week, managing your weight. And something that often gets overlooked, prioritizing good sleep. And these aren't just vague suggestions, they are powerful. For real, just a 5% loss in body weight can make a dramatic difference in symptoms.
After you've got that lifestyle foundation sorted, then you can talk about medical treatments. And this is where it gets really personalized. The plan is going to look totally different depending on your goals. Are you just trying to get your cycle regular and clear up your skin? Or are you trying to get pregnant? The medical approach changes completely based on what you need.
But here's the thing. Managing PCOS isn't just about feeling better today. It's really about playing the long game. It's about being proactive and protecting your future health. And being proactive is so important because the stakes are pretty high. Because of all that metabolic stuff we talked about, unmanaged PCOS can significantly raise your risk for other serious health issues later on. We're talking type 2 diabetes, heart problems, sleep apnea, and even certain types of cancer.
Let's just focus on one of those for a second to really put it in perspective. Women with PCOS are 4 times more likely to develop type 2 diabetes. 4 times. That's a direct line back to that insulin resistance we talked about at the beginning. See how it all connects?
But, and this is the most important part, none of this has to happen. It is not your destiny. Taking charge, being proactive, and consistently using those tools we talked about, that is your single most powerful weapon to lower these risks and truly own your long-term health.
Look, PCOS is complex, and for a lot of people, it's a lifelong journey. It's about learning what works for your body and adapting. So the question I want to leave you with is this. Whether this is for you or for someone you love, what's the first step you're going to take?